approach to all the variants is sort of the same. So we're really preparing just for the next wave of infections.
As we're seeing across about rising COVID-19 cases from the Delta variant, Houston Methodist Hospital reported its first case of the Lambda variant. Dr. Randall J. Olson joins us now. He's the medical director of the Molecular Diagnostics Laboratory at Houston Methodist. Dr. Olson, good morning. Thank you for being here. I think so much of this variant stuff can just feel pretty overwhelming and feel like each new one we hear about sounds scarier than the last, but just kind of walk us through this Lambda variant compared to the Delta variant, and then also the initial strain of COVID-19 that we saw last year and what it means for people, especially in your area.
Sure. So thanks for having me. The Lambda variant is sort of interesting in that it's gotten a lot of attention in the lay and scientific press over the last week or two. And this is in part because it's been recently upgraded to a variant of interest by the World Health Organization. That means we're keeping a close eye on it because it's got some mutations that are concerning. However, when you look at it overall, at all the mutations it has, it's probably less concerning than the Alpha and Delta variants that are causing massive waves of infection across the United States.
So what does the Lambda variant mean in terms of fighting this virus, and how's your hospital preparing for more cases of Lambda and also of other variants?
Right. So we're preparing for not only Lambda, but all the variants and keeping a close eye on all of them. Right now we're clearly seeing the start of a fourth massive wave of infections in Houston. So we're preparing. We're starting to reinvigorate some of the precautions that had been paused during the trough after the third wave. And, as I mentioned, really the treatment or the approach to all the variants is sort of the same. So we're really preparing just for the next wave of infections.
As we're seeing across the country, unfortunately. Dr. Olson, we're approaching a year and a half of fighting this pandemic. Many of the headlines, unfortunately, right now sound more similarly to the beginning of the pandemic than when we've been doing better in recent months. Just how are you and your coworkers doing?
Well, I think like everyone, we're fatigued, but, we've been through 3 massive waves previously. So using lessons learned through those, I think our game plan going into this next wave is pretty well established. We're certainly, preparing for the surge. I work in the laboratory, and we're preparing for a surge in the number of new tests to be performed, particularly on our rapid platforms that we save for our sickest patients.
All right, Dr. Olson, well, thank you for what you're doing. Thank you for joining us, and we'll be thinking about you as we all head into this fourth wave. Thanks again.
Great, thank you.